This is initial phase where the nurse gathers data about the patient's health status.
In this stage, the nurse analyzes the collected data to identify the patient's health problems.
Once nursing diagnoses are identified, the nurse collaborates with the patient, their family, and other healthcare professionals.
This phase involves putting the care plan into action.
The final stage informs of assessing the effectiveness of the care plan and the progress towards achieving the established goals.
Hello everyone, good morning.
Good morning.
Well, students, today I would like to review the ADPIE in nursing process that I explained completely last week. I hope you still remember what it is. After all, I would like to ask you the steps of the nursing process of ADPIE in order that I know you really understand it well. Okay, now listen to me. ADPIE is a well-known term used in nursing that represents 5 steps of the nursing process, which included as follows. 1. Assessment. Assessment is the first step where the nurse collects data about the patient's health status by interviewing the patient and the patient's family. Before conducting an assessment, a nurse typically prepares by gathering the necessary tools, equipment, and resources. Here are some common steps a nurse may take to prepare for an assessment. 1. Reviewing the patient's medical history. 2. Assembling assessment tools. 3. Entering privacy and comfort. 4. Gathering documentation materials. 5. Reviewing assessment protocols. 6. Mentally preparing for the assessment. 7. Establishing rapport with the patients. By taking these preparatory steps, the nurse sets the stage for a comprehensive and effective assessment that forms the foundation for nursing care planning and interventions. 2. Diagnosis. After assessment to collect the data of the patient's health status, the nurse analyzes the collected data to identify the patient's health problems, risks, and strengths. Nursing diagnoses are formulated based on the assessment findings, which help guide the development of a care plan for the patient. 3. Planning. After nursing diagnoses are identified, the nurse collaborates with the patient, their family, and other healthcare professionals to establish goals and develop a comprehensive care plan. This plan outlines the interventions and strategies to address the patient's health needs and achieve desired outcomes. In collaboration and communication, nurses collaborate with other members of the healthcare team, including physicians, therapists, social workers, and pharmacists, to coordinate care and ensure continuity. Effective communication is essential for sharing information, discussing patient progress, and addressing any concerns or changes in the care plan. 4. Implementation. Implementation involves putting the care plan into action. The nurse carries out the planned interventions, monitors the patient's response to treatment, and adjusts the care plan as needed. Implementation also includes educating and supporting the patient and their families to promote self-care and wellness. Throughout the implementation phase, nurses document their actions, observations, and patient responses in the medical record or electronic health records EHR. Accurate and thorough documentation is critical for communication, legal protection, quality assurance, and continuity of care. 5. Evaluation. The final step involves assessing the effectiveness of the care plan and the progress towards achieving the established goals. The nurse compares the patient's current status with the expected outcomes and identifies any deviations or areas for improvement. Evaluation is an ongoing process that informs further adjustments to the care plan and ensures quality care delivery. ADPIE provides a systematic framework for nursing practice, helping nurses deliver holistic and evidence-based care to patients across various healthcare settings. Okay, students, now your turn. Madeline Angel Oimatan, what do you know about assessment in nursing process?
Assessment. This is initial phase where the nurse gathers data about the patient's health status, including physical, emotional, social, and spiritual aspects. This involves collecting subjective and objective information through interviews, physical exams, and review of medical records.
The next one, Cinta Maya Timboro. How is the diagnosis determined?
Diagnosis. In this stage, the nurse analyzes the collected data to identify the patient's health problems, risks, and strengths. Nursing diagnoses are formulated based on the assessment findings, which help guide the development of a care plan.
It's okay. The next, Bani Mira. What is planning in nursing process?
Once nursing diagnoses are identified, the nurse collaborates with the patient, their family, and other healthcare professionals to establish goals and develop a comprehensive care plan. This plan outlines the interventions and strategies to address the patient's health needs and achieve desired outcomes.
The next, Yudita Achas. What do you know about implementation in nursing process?
Implementation. This piece involves putting the care plan into action. The nurse carries out the planned interventions, monitor the patient's response to treatment, and adjust the care plan as needed. Implementations also includes educating and supporting the patients and their family to promote self-care and wellness.
The last, Sandra Junita Mela. The last step in nursing process is evaluation. What do you know about the step?
Evaluation. The final stage informs of assessing the effectiveness of the care plan and the progress towards achieving the established goals. The nurse compares the patient's current status with the expected outcomes and identifies any deviations or area for improvement. Evaluation is an ongoing process that informs further adjustments to the care plan and ensures quality care delivery.